Well, it turns out that hormone imbalances, things like estrogen dominance and low progesterone and low testosterone, low DHEA, and even high estrogen could be additional challenges filling up your histamine and MCAS bucket. In today's video, I'm going to explain to you how sex hormones are connected to histamine intolerance and MCAS. And if you stay with me all the way to the end, I'm going to share with you 5 lifestyle tips that you can start implementing today that will help your hormones, which in turn will help your histamine intolerance and MCAS symptoms. If you're just joining me, I'm Dr. Hagmeyer. I'm the clinic director here at drhagmeyer.com, where we help patients who struggle with chronic health problems find answers and solutions to some of the most challenging health problems. Dealing with histamine intolerance and MCAS can be incredibly challenging, and this is due to the fact that there are really just many aspects of your health that need to be considered above and beyond a high histamine diet. Yet these are areas that are often overlooked, and sadly, most doctors tend to think that living on histamine blockers is really the answer and the solution to histamine intolerance and MCAS. And I'm here to tell you today that this is not a solution. You cannot live on these medications long term. They will have serious consequences on your health. You need to focus on the big picture. I like to use the bucket analogy. Whenever I talk about histamine intolerance and MCAS, there are actual root causes behind this, right? And so in this video series, we're talking about many different parts, or things for that matter, that fill up your bucket, your histamine and MCAS bucket, causing it to overflow. And of course, the more you struggle with the symptoms of histamine intolerance and MCAS, the more you're going to miss out on life. And so your bucket is filled up not because there is a shortage of Zyrtec or Zantac or Benadryl or Claritin in your blood, and taking H1 and H2 blockers does not stop why you have excess histamines in your body in the first place. Some people with MCAS and histamine intolerance have a bucket that is just filled with all kinds of problems. But if you're serious about getting your life back and feeling good again and being in control of your life, your focus really needs to be on understanding what's filling up your bucket. Not your Facebook friends bucket, but what's filling up your histamine and MCAS bucket. We're all different. And so when it comes to histamine intolerance, what's filling up and causing your bucket to overflow is obviously going to be very different than what's causing my histamine bucket to be overflowing. Now, in past videos, I've talked about gut health. I've talked about mold allergies. I've talked about mold biotoxins. I've talked about various things that are related to triggering this histamine intolerance and MCAS. And so today, I want to talk about another contributing factor that could be filling up your histamine and MCAS bucket. Today, we're talking about the connection between sex hormones and histamine intolerance and MCAS. Right? So you might be wondering how sex hormones affect your body, how they affect mast cells. Well, if you stay with me, there's some pretty interesting things that I want to share with you. It turns out that your sex hormones affect mast cells in many different ways. And while it's true that more women seem to struggle with histamine intolerance than men, men who have hormone imbalances are also at great risk. All right. Now, if we take a look at this study here, this was a study that was done in an article, journal rather, of multidisciplinary respiratory medicine. And it was shown that fluctuations of estrogen trigger mast cells to degranulate, while testosterone and other androgens are credited to having a stabilizing effect. Progesterone has also been shown to have a stabilizing effect on mast cells. Now, let's break this up a little bit. What does this mean to you, right? And how does this apply to you? And how does this apply to your histamine and MCAS symptoms? Well, first thing, this study reminds us that estrogen triggers mast cells to break down, right? There's a big fancy medical term that's often thrown around. It's called degranulation, right? And so when mast cells break down, or when they degranulate, they release histamine as well as a bunch of other chemical immune mediators, right? We also know from other studies that high levels of histamine stimulate estrogen. So what we have going on here is we have this vicious cycle, right, where we have this high estrogen causing mast cells to break apart and degranulate, releasing all this histamine, and we have histamine leading to more estrogen production. And so again, this is just one big nasty cycle. But to make matters worse, we also know that estrogen decreases DAO activity. And from previous videos, we talked about DAO being the enzyme that breaks down histamine, right? We talked about that in the video where we talked about mold, and we talked about that in the video where we talked about SIBO, some things related to gut health and histamine intolerance. But again, for those of you that are just joining us, again, DAO is this enzyme that breaks down histamine, right? There's two of them. There's DAO and HNMT. But if you're a woman, and let's say you have terrible menstrual cramps, or you have increased heart rate, you feel like your heart's racing, you have anxiety, maybe you have low blood pressure, here again is why this is so important to you. The muscular layer of the uterus is loaded with H1 receptors. Now, when estrogen or histamine bind to those H1 receptors, your uterus begins to contract. And one of the causes behind those painful cramps that you experience could be due to, number one, an excess of estrogen, which again, that estrogen blocks that DAO enzyme activity, which again causes excess histamine. And number two, estrogen causes mast cells to degranulate. And again, this again leads to more histamine release. So again, we have this vicious cycle that's going on. And this may explain again why you have some of those symptoms. So again, how does this tie into, again, some of the other symptoms that you might be experiencing? Well, H1 receptors are not only found in that muscular layer of the uterus, but it turns out that these H1 receptors are also found in the heart, they're found in the brain, they're found in the skin, they're found in the urinary tract, they're found in blood vessels, they're found in arteries, and they're found in capillaries. And this again is why you experience symptoms in so many different body parts. Now, the second thing that this study really points out is that sex hormones like testosterone and progesterone, these hormones actually have a stabilizing effect on mast cells. So again, if you're a man and you have low testosterone, or you're a man who has high estrogen, you are more prone to suffer with these symptoms of histamine intolerance and MCAS than a man who has healthy levels of testosterone and normal levels of estrogen. The second scenario applies to women who have low progesterone, right? Things like women during menopause or perimenopause. It might be a woman who has high estrogen from synthetic forms of birth control pills, or synthetic forms of estrogen like birth control pills, or hormones found in an IUD, or if you're a postmenopausal woman taking HRT. So again, these are all scenarios where women are most prone to developing estrogen dominance. Again, this could be the woman with low testosterone. Again, synthetic hormones always cause more problems than they fix. So they often make histamine and MCAS symptoms so much worse, and I want you to know that. So I recommend that if you are considering the use of these synthetic estrogens, pills, patches, IUDs, HRT, and these aren't bioidentical hormones, I want you to research and exhaust all other avenues before you get to that point, right? It's always best to address the root cause of your hormone imbalance before jumping to synthetic hormones, right? So what can you start doing today if you suspect that hormone imbalances are filling up this histamine MCAS bucket, right? Well, number one, I want to share with you again 5 hormone lifestyle tips to help reduce this excess level of estrogen. So number one is exercise, right? This is so very important. By shedding extra pounds, you will actually reduce your estrogen load. And that's because estrogen is often stored in fat tissues. The more fat you have, the more estrogen dominant you become. The more estrogen you make, the more histamine you make, the more you block the DAO enzyme activity. So again, fat cells in the breast tissue, in the belly, in the back of the arms, these areas, these become reservoirs where your hormones can become problematic, right? This is where your androgens can actually get converted into estrogens. This is a process called aromatization. Right? Now, when your testosterone levels get converted into estrogen, this of course leaves you with low testosterone levels. And again, we now know in a man, or even a woman for that matter, that testosterone has a stabilizing effect on your mast cells, right? So the best kind of exercise for this kind of problem is going to be high intensity interval training, right? And you can Google this if you want. Just Google high intensity interval training's effects on testosterone levels. Tip number 2 is change the kind of beauty products that you're using if you are a man, right? If you take a look at the different kinds of skincare that you use, maybe the soaps, your cologne, Most of your personal care products can be a major culprit for chemicals that mimic estrogen found within the body. All right, we call these endocrine disruptors. So again, if you are using these things, opt for more natural choices. Opt for more natural kinds of makeup, more natural kinds of soap, natural deodorants, natural lipsticks, natural shampoos, natural, everything. Just use natural deodorants as much as possible, right? The other thing is stop using plastic, right? Plastic affects the immune system, and plastic, of course, can cause more hormone imbalances, especially when we get to talking about the thyroid. All right, I have another video that's coming out that'll be talking specifically about histamine intolerance and the thyroid function. So this is very much applicable to you if you're watching today's video and you have thyroid problems. Now, tip number 3, when possible, again, avoid all forms of synthetic hormones, right? This is going to include things like birth control pills, patches, IUDs, hormone replacement therapy. Again, for all the reasons that I mentioned as it relates to histamine, a woman's body was never designed to be exposed to high levels of these synthetic, unnatural hormones, right? And you often see these, again, in HRT, in birth control pills, and in patches, right? These are not normal for a woman's body. And so if you're a man, be very, very careful with testosterone replacement, because most men with hormone imbalances usually have testosterone that's getting converted into estrogen. Remember, testosterone has a stabilizing effect on histamine levels and on your mast cells. And if you take testosterone and your testosterone levels get converted into estrogen, which often happens very frequently in men, you're going to flood your body with, again, more histamine. All right. So tip number 4, get your stress under control, right? Stress hormones like cortisol have a profound impact, not only on histamine, but also on thyroid function, but also on your sex hormones. And again, in an upcoming video, I'll talk more about this connection between stress, cortisol, and histamine levels. So again, be sure you subscribe to my channel, hit that notification button. You'll know when I post new videos. Obviously, the other thing I would quick to mention is from a dietary standpoint, before I forget, is eat more fiber. Fiber, again, will help keep your bowels regular. It'll help eliminate waste. It'll help eliminate extra estrogen. If you have SIBO, of course, skip this step, because we know that fiber can flare up and exacerbate an underlying bacterial overgrowth. And so in closing, I have a couple things I want to share with you before I wrap up today's video. Number 1 is, if you want to feel better and you want to start having more good days than bad days, you need to identify, again, your root cause. What's filling up your bucket? Number 2, if you're having symptoms of hormone imbalance alongside histamine intolerance and MCAS symptoms, you really need to get your hormones properly evaluated. Now, there are 3 main ways to get your hormones tested and assessed, right? There's blood testing, there's saliva testing, and then there's urine testing. And then there's also testing for women that are cycling and non-cycling. And so again, these are just different tests that evaluate and assess different things. Each of these tests provides information, for example, that the other test specimen doesn't. And so which test you need, or which one you will benefit from, really depends on several factors and really what's going on with you. Things like your age, your symptoms, if you're cycling, if you're not cycling, if you're currently on hormone replacement therapy, how long you've been on hormone replacement therapy, what other kinds of medications and hormones you might be on, if you take thyroid medications. So unfortunately, there's a lot of different variables that really dictate and determine what kind of test is going to be best for you. And again, not knowing anything about you, I don't know which type of testing is going to be the most appropriate based on what your needs are. Right? So that's something, again, your functional medicine doctor, they're going to be able to help you with, and they're going to be able to determine what tests are most beneficial and what markers really should be run. And so that brings us to number 3. If you want help, maybe you're hit a dead wall, you're hit a dead end, right? You're basically don't know what else to do. If you want help trying to figure out this histamine intolerance MCAS puzzle, and you really want my perspective, you can always visit my website. You can schedule what we call a case review under my service tab. If you feel you need help, more help implementing a low histamine diet, I have several different nutritionists that they can help you with this, and they can guide you through a histamine elimination diet, as well as help you with things like meal planning and recipes and ideas on what you should eat. All right, so that's going to wrap up today's video on the connection between sex hormones and histamine intolerance. If you like today's video, again, be sure you comment below, subscribe to the channel, help us get this message out to people. And like I mentioned earlier, make sure you hit the notification button. This way, whenever we upload new content, new videos, you'll be notified. And if that's a topic that's of interest to you, you can obviously click on that and take advantage of all the great information that we share with you. I'm Dr. Hagmeyer, and I hope to see you at the next video. Take care.